Okay, everybody, this is Sophia Aragon with the Washington Center for Nursing, and we are going to begin a webinar on data exchange between state nursing workforce centers and boards of nursing across the country. And we're going to be looking at Indiana, Connecticut, and North Dakota. And I just want to make some opening remarks in terms of attendance this morning. On this webinar, we will have members of the board of the Washington Center for Nursing and staff. Also invited were the commissioners on the Nursing Care Quality Assurance Commission, that's the Washington State Board of Nursing, as well as staff. And also this webinar will be recorded, as some key staff and also board members or commissioners were unable to make it today, so we wanted to make sure that this resource was available. And also we've received feedback from forum members of the state nursing workforce centers that this is an issue of interest for other states who are also wanting to embark on a similar project. Okay. Next slide, please. Okay, so just quickly reviewing the agenda. So we'll be hearing from 3 nursing workforce centers and also their lessons learned, and a open session for questions and answers. If anyone has questions during the presenter's time, please use the chat function and enter your question there, and we will read it out loud when we pause in between the presentations. As for the final Q&A from participants, we will create an open forum so that we can have open dialogue. So a little bit of background, Washington State efforts to collect nursing data as a requirement. We've had voluntary efforts prior to that. It's now a requirement of licensure starting in 2018. And we are using a survey called the Nursing Supply Data Set. And what that is it provides characteristics of the nursing workforce, and the attempt is to capture data on demographics, education, state distribution of nurses, their job activities, workplace settings, and specialty. And when we refer to the minimum nursing data set, that simply refers to a standard model survey. Okay. So a little bit about the Center for Nursing. We are funded by a surcharge on registered nurse and licensed practical nurse licenses according to statute. And we demonstrate coordination with relevant nursing constituents, maintain information on the current and projected supply and demand of nurses, as we are today in terms of the supply of nurses, facilitate partnerships, evaluate effectiveness of nursing education, and also educate the public about nursing. So we are the Washington State Nursing Workforce Center. Okay, and just touching really briefly on the roles of the Washington Center for Nursing and the Nursing Care Quality Assurance Commission on this activity. As I said, we received this surcharge in the form of a grant to do a number of activities, including the one we are talking about today. And our Nursing Care Quality Assurance Commission is our board of nursing here in the state of Washington, licensing LPNs, RNs, and ARNPs. In 2018, the Nursing Commission implemented the Nurses e-Notify survey, which is implemented by the National Council of State Boards of Nursing in consultation with the Forum of National Workforce Centers as a tool for states to use to collect supply data. The data is being collected now as nurses are applying for licensure and renewing their license. In 2019, the data will be analyzed and published by WCN. And what's omitted here is that the University of Washington Center for Workforce Studies is contracted by the WCN to perform the analysis. And reports at this time is planned to be available annually. All right. So the first state that we want to have to share their experience in collecting supply data is the Indiana Center for Nursing, and our presenter today is Kimberly Harper, who is the CEO for the ICN. Kimberly, I'm going to turn it over to you.
Great. Thank you so much, and good afternoon or good morning to you, wherever you happen to be across America today, or when you hear this, if you're listening to the webinar that's been recorded. I'm delighted to have the opportunity to talk with you today and tell a little bit about the story as it goes in Indiana. We are obviously in the center of the country and kind of a Midwestern state. We're pretty conservative here in Indiana, as you can imagine. And a lot of information gets shared back and forth with a lot of people, and this is an example of that and how we work together. Next slide, please. Our Center for Nursing is an independent 501c3 not-for-profit organization. We do not get money from licensure fees or anything like that. We are a member organization, and we have well over 50 members representing approximately 80 locations. These are schools of nursing, acute care settings, long-term care industry. We have associations at the table as well. Our organizational bylaws require that our member categories would be either schools of nursing or employer groups. So those who either educate nurses or employ them. Our funding comes completely from membership dues and a few grants, and our annual budget's just over $500,000 a year. Next slide, please. We are the home of the Indiana Action Coalition. So with regard to the Future of Nursing Campaign for Action, the Action Coalition and the Center for Nursing are one and the same here. We all do the same work, and it's all integrated collaboratively. Our board of our Center for Nursing is composed of deans and chief nursing officers from all of our member organizations. So if you are a member within the Indiana Center for Nursing, a school or an employer group, and you have a membership, then that organization is a member, and that organization gets to define who that representative would be on the board, and everyone gets a seat. So we have a very large board, and it has been very positive in the fact that we pretty much bring everybody to the table. You know, when we have board meetings, about half the people are in the room and about half the people are on the phone, but we have a large group of nurse leaders across the state. So in addition to our member organizations that have their representative at the table, we also invite to the table with a vote the Indiana Organization of Nurse Executives, our Indiana State Nurses Association, the Council of Indiana Nursing Deans and Directors, which is a part of our Center for Nursing, the Indiana League for Nursing, our Indiana State Board of Nursing has a seat there, and our Hospital Association. So we literally bring everybody in nursing to the table within the umbrella of the Indiana Center for Nursing. Now, these organizations obviously are their own separate entities. They're not a part of our center, but their voice is invited and present at every one of our board meetings. Next slide, please. The strategic focus areas of our center are that we're one voice, one center for nursing. We recognize we don't have all the answers. We're not the experts in every area, but it's kind of a one-stop shop. Calls come here, and then we send them out to the appropriate organization, and everyone has agreed that that's the best thing, rather than having media and legislative folks and everybody calling all around, trying to figure out who's the best person to speak for something. Designing Indiana's nursing role and influencing the emerging healthcare delivery system is a big focus of ours, and what nursing should look like in the future. We also are very concerned about building Indiana's nursing workforce, physician nurses as leaders in promoting health. That's where our workforce data falls. It falls within that category. Nursing scholarships and tuition assistance is very important to us. We raise and give away about $150,000 a year to our nursing students across the state. That money is raised through galas and through monetary donations from individuals, and anything that I obtain from an honorarium or a speaking fee, I put into that. And then that money goes to our member schools. It's divided equally, and the member schools then select the students that receive that assistance. Our academic practice partnerships are very important. One of the things that makes our center so successful is we have both practice and education at the table. All of our work is done by committees, and we have co-chairs of all of our committees and initiatives, and with all of them, one of the co-chairs is from practice and one is from education. So we really work closely to recognize the fact that neither one has all the answers, but collaboratively and collectively we do. And then obviously increasing diversity to reflect the population of the state is another one of our focus areas. Next slide. The mission is very clear. We are here to unite statewide nursing education practice leaders to effect change through one voice to ensure a high qualified nursing workforce that meets the needs of Indiana's healthcare consumers. And I think that's very similar to the mission of the other organizations like ours across the country. Next slide. When we talk about data collection, I think it's safe to say that's a big part of what we do, yet it's not all we do. You know, it's one of our many focus areas. We have a data committee, and it is made up of a chief nursing officer as a co-chair as well as a dean of one of the schools of nursing. And they work collaboratively with a committee, and we work a lot on this, although we do lots of other things as well. We're not a completely data-driven state. I know I wouldn't say that. I back that up. We are data-driven. We make our decisions based on data, but we don't do a lot of data collection. That's one of the many things that we do. It's not the only thing that we do. We do collect data within our state as a organized effort for supply, education, and demand. And today we're going to talk about the supply data collection. So the organizations within the state of Indiana that participate in this, working collaboratively together, are our Indiana Center for Nursing, and that includes the Council of Deans and Directors of Schools of Nursing, which I said is part of our center. The Indiana State Board of Nursing is very involved in this as well. The Indiana State Department of Health and the Bowen Center for Health Research and Policy within Indiana University. And so just for perception for people, you know, again, this is a group that works collaboratively together. Nobody owns this. We all just work on it collectively, and we have great outcomes that we all claim as all of ours. It doesn't belong to any one group. Next slide, please. So the way it works is that we have a statewide advisory council that is led by the Bowen Center for Health Research and Policy at Indiana University. And it oversees the process, and it pulls together the meetings and those things. That council includes representatives from all the previously listed organizations. So we have representation there from the Center for Nursing and the Council of Deans and Directors, the State Board, and the Department of Health and the folks at Bowen. The council meets regularly, and we kind of keep this going pretty much all the time because there's always something to do. But the way the system would work is that we meet to discuss and agree upon the questions of what will be added into the survey. Our surveys are done every other year with license renewal. And we've always done it. It's been a part of our process within nursing in Indiana for many years. And we've always had like a 97% participation rate, even though it's not been mandatory. Within our legislative session last year, health workforce data was made mandatory. So we're way ahead of the game. Other professions have not had that good of a return, and some of them haven't even participated. So we are always going to have this at this point now, even if somebody decided that we didn't want it, which I can't imagine because it's been such a great opportunity to work together. It will be something that we'll maintain. The questions are included with both the RN and the LPN license renewals. They're opposite years. So one year we do RN renewals, and then the next year we do LPN renewals. The data has been collected. It's part of the online process of renewing licensure, and it's tabulated and it's placed into the Bowen portal. And the portal, as we define it, is a vast group of data. It's a kind of a opportunity for us to place our data places in this place, but everybody can access it, which I'll get to in a minute. And that's really the exciting part of all this. The data is then analyzed, and a report is created by the council, and we all work collaboratively to create that report and to analyze this data. Next slide, please. The formal report is available both digitally and online, so there are hard copies and it's online. It's disseminated by all of us who are involved in this, by presentations at meetings and at summits. We have workforce summits in the state. We have nursing summits in the state. We all have websites. We all post this data on our websites, and you could find this data on our website right now. And then through social media, when new reports come out, we make a big blast across the state that the new information is out, and we make it available to everyone who's interested. And then the process repeats every 2 years. And as I said, it seems like we're always in some point of this process. One of the things we want to always point out is that the nice part about this is that this data that we utilize to create this is available within this Bowen portal. So if someone goes to the Bowen website, they can find the data, they can pick nursing of the categories, and then you can go in and you can actually create your own report based on what you want. So if you have, for example, a school of nursing in a specific area of the state, or a hospital or acute care setting, or a long-term care facility in a different part of the state, you can look at the data and say, how many RNs are there in this county, you know, what are their specialty areas, and you can pull it all, whatever fields you want. We make that available to anyone who wants to utilize that data. And it's all set up that it creates a really nice report, and it puts it all in kind of an infographic looking report that is specific to whatever the information that the organization or the person that created it wants to do. It's great for grants. You know, that opportunity is available for anybody that wants to go in and pull that data or manipulate the data. It's all aggregate. There's no specific information specific to Kimberly Harper, registered nurse. It's aggregate data. You know, I would be in there as a registered nurse who lives in Marion County in Indianapolis, Indiana. Next slide, please. These are what the reports look like, and I will have to say that, you know, this is part of the working together phase. The Bowen Center got a little behind, so the most recent one, we were promised we'd have the 1st of July. We've seen it all, we've approved it all, but we've not seen it come out yet, so we're still waiting any day. I was hoping to be able to flip these out at the last minute, but it's not out, so I cannot do that. But these are copies of what is available, like I said, online in any of our organizations. It's easy to find. There is a data report that we do that's very long, and it's very inclusive, includes a lot of data tables, and it's about a 27-page document. And then that information is pulled into an executive brief that we call a policy brief, which is what the second document is that you see there. And again, the newest ones will come out any day and be available on our website. Next slide, please. So I think in wrapping this up in summary, from our perspective, it's all about relationships. In Indiana, we all work very well together. I think working across so many organizations isn't always easy. In comparison, I can tell you that when we did a demand survey, we did it. The Center for Nursing did it. It was all ours. We did, we collected the data, we analyzed the data, we reported the data. That's a lot easier, but it's not the way it always works. So, we are delighted to be a part of this process. We're delighted that they include the Center for Nursing at a very high level. We're happy that other people are, setting the meetings for once and getting it all put together. But working as a group does make it a little bit more difficult. What I think we've had the ability to do is right up front when we started working together on this, everybody said, here's what we have to have. In order for this information to be helpful to us, this is what we have to have. And so the other part of that is respecting one another's wishes when we come to, what extra questions do we add? Our Bowen Center says we just want to use the HRSA data set. And we say, no, that doesn't include all the things we want. We need some more. And so, they're willing to add the questions. And then the State Board, of course, is willing to create the mechanism with the licensure renewal that includes all of those questions and then shares that information back. I think that fourth bullet there is probably the most important, and that is that, we always have to keep in mind that it's the outcome that matters and not who owns or controls the process. Because I can tell you that, in other situations, across our state, not necessarily nursing, but other professions and some of the other situations, it can really blow up if everybody says, this is mine, this is ours, we want only our logo on this, we don't need your input. That's not the way we work here, and because of that, I think we've got some really great data that everybody can share and everybody can feel good about. And so the last thing, I think I would share is never ever give up. if you're not there today, you know, there's hope. You know, you can pull this together, and it just requires dedicated people who are committed to making it work. And again, making sure that people say, you know, we're in this for the good of the cause. We're not in this for us. So with that, I would ask, you know, are there any questions, or do you want to hold on questions, Sophia? Let me know how you want to handle that.
Okay. Kim, I don't have any questions right now on my chat box, and
okay.
We have like a minute or so. So does anyone have questions for Kim?
If you want to switch to my contact information, people can see that. One more, there you go. If anybody has a question they want to contact me directly, please feel free to. I'm more than glad to help in any way that I can, or answer any questions about what we do in Indiana. Thank you very much.
Thank you, Kim. So our next presenter is from our colleagues at the Connecticut Center for Nursing and the Connecticut Center for Nursing Workforce. And their executive director, Marsha Proto, is here this morning to let us know their experience.
Good morning, good afternoon. My name is Marsha Proto, and as Sophia had shared, I'm actually the executive director for the Connecticut League for Nursing and the Connecticut Center for Nursing Workforce. And Connecticut is a very small state, and many of our organizations wear numerous hats. And we kind of fell into this just a couple of years ago. Our center is much younger than Kim's in Indiana, and have really been going through some growing pains. But first, I'd like to share with you the mission of the League, which is to promote excellence in nursing education, to build a strong and diverse workforce to advance the nation's health. And we're what's called the constituent league of the National League for Nursing. And so in Connecticut, our major players are the Connecticut Hospital Association, the Nurses Association, and then really our state agencies. So we don't have a very deep bench in nursing. Next slide, please. Thank you. We were actually founded in 1953, and our focus was how do we serve all the schools and programs of nursing in Connecticut, from doctoral down to LPN, and really how the impact of a well-educated nursing workforce makes a significant impact on the practice setting. We also were, off the bat, in addition to the schools and programs of nursing, a few of our practice settings, the larger ones, Yale and Hartford, were very instrumental in pulling the organization together. In 2013, we were actually doing some work with the Robert Wood Johnson Foundation, and we're one of the organizations that supported the formation of our Action Coalition in the state. And the more we learned about Robert Wood Johnson and what they were focusing on through their Center to Champion Nursing in America, we stumbled upon, believe it or not, the workforce centers. And I believe it was Patricia Moulton that one of my board members ran into back in 2013. And Patricia was talking about data and what they're doing. And the League over time, probably 20 years back, we were putting together quite a few data reports on nursing education and the impact of faculty, but really never picked up on that there was a minimum data set for education, a minimum data set for supply, and then ultimately a minimum data set for demand. And so in 2013, we reached out and we actually joined the National Forum of State Nursing Workforce Centers. And we are so fortunate, obviously, as you know, Sophia is our president of that national organization and doing a beautiful job, as well as her predecessors, both Patricia and Kim, in really making the workforce centers collectively across the country really share their expertise, as well as knowledge of how to really effectively use data to make those decisions for your state. So we've been very fortunate. And because the work we've been doing for 5 years, and our board of directors at the Connecticut League for Nursing said, you know, we need to continue this in a more formal way. About a month and a half ago, we submitted paperwork to become our own 501c3 for the Connecticut Center for Nursing Workforce. And so we hope to obtain that 501c designation in 2018. So really, really excited that from a statewide perspective, even our peers and colleagues, the Hospital Association, Department of Public Health, our Nurses Association, realize that we need a focal point. Unfortunately, in the state of Connecticut, we do not have any paid nursing leadership. Our Board of Nursing is totally voluntary, and in the Department of Public Health, we do not have a true point person that will champion nursing workforce and data. We've worked with our Department of Labor in the past for supply, and they've been supportive to a point, but really haven't jumped in. So we decided as a board and organization that we're going to step in. The League is about a $530,000 organization annually, so we clearly have some capacity as well as staff to augment our efforts in data. Next slide, please. As I noted, for 15 years, we've really been in collaboration, collecting education data and really looking at our pipelines and our faculty. What we found out that we do not have an adequate pipeline for faculty, have a significant shortage of clinical faculty, which in turn will have a shortage in our full-time faculty as we look at how our faculty is aging out, which goes right into our supply concerns. Next slide, please. What we have used from the National Council was the sample survey data that has been pulled for the past, I guess, 10 to 15 years using the National Forum's minimum data set for supply. And we're fortunate as a forum member every year or every other year to get a sample data set for our supply for nursing. And we've been happy and delighted that we have had some support from our Action Coalition to really look at that data, analyze it, and come up with a high-level overview of what Connecticut's demographics look like. Since we were working with our education data for so long, actually last year, we combined it into one report to really look at our education and supply data and how it intertwines. And we clearly, when we're looking at our nurses over 50 in our workforce, 57% are over 50, which is a real cause for concern, especially to meet demands from our employers. Next slide, please. We have heard for numerous years when we get together that other states are actually currently experiencing a nurses shortage. Right now, Connecticut is not, but we're really trying to plan and be as proactive as possible. And so our whole focus of our workforce center is to make sure that we're producing the right number of nurses with the right credentials and expertise at all levels to meet the nursing workforce demands across the continuum. And as I noted, for the past 15 years, we have produced some reports. And so I had put a link in the PowerPoint, which has listed our reports that we've been putting out for the past 15 years on education and supply and faculty needs. Next slide, please. And so as it relates to the minimum data set for education, for years it's been a collaborative project between our Department of Public Health and the Connecticut League for Nursing. And just last December of 2017, Public Health shared that they didn't have the resources to do so and asked us if we would be interested in doing the whole list of not only putting together the minimum data set for education, and we do tweak the questions based on our member needs, our school needs. So we actually have the survey on our platform. We send out the survey to our members, both the LPN and the RN schools for pre-licensure, and are in charge with really capturing that nursing student pipeline data and then the full-time, part-time nursing faculty. And so we just presented our final board findings on our 2017 data to our State Board of Nursing, and they have published that information on their website. One thing that we are very nervous about is when we did some analysis of our education data, we realized that our pre-licensure programs for RNs, the Associate, Baccalaureate, and Accelerated, are currently at 97% capacity. Plus, we only accept, on a statewide basis, 24% of our applicants to our nursing program. We have over 10,000 applicants, and we only accept about 2,480. So we have a significant bottleneck in providing educational opportunities, and you'll see how this goes hand in glove to how this impacts our supply data. Next slide, please. So for supply, we have a larger cadre of folks who assist us, our Connecticut Department of Public Health, and we're very excited as we just talked with the commissioner this year, and for the first time, he wants to put together a nursing workforce report. So it's quite interesting how, even though we've been in this for a while, as Kim alluded to, relationships are so important. He did identify 2 individuals in his office, a data analyst and an epidemiologist who would assist us with this. And we also have an organization called the Connecticut Data Collaborative in our state. They're an organization who supports the publishing of open data. And what they do is they look for data sets that they can, as Kim alluded to, de-identify, put up on their website, all different products, services, education, community, policing, first responders. They have some wonderful data up there. And as Kim alluded to, you can sort things by geography if you wanted to pull information, anything for early childhood. They are very interested in getting the nursing data on their website, especially for advanced practice nurses. So we are working with both entities to pull together our supply report. We are fortunate enough that finally our Department of Public Health did make it mandatory to fill out the minimum data set for supply as part of the relicensure. Our organization, our Department of Public Health, we relicense our nurses every year, and it's $100 to relicense, and they do that for both the RNs and the LPNs. So this is the first time that we've been able to secure the full data set for both of our practicing nurses. And it was interesting that they didn't want to initially give us the data, but it was for a Freedom of Information Act or FOIA request by the Connecticut Data Collaborative. The executive director is on our board of directors for the league, and she put that forth, and then 2 weeks later we received our 64,000 plus data set, so we're very excited about that. And currently I'm in the throes of the final analysis of all the data tables that came back from our Department of Public Health, the 2 folks who were supporting us to work on it, and we should be getting our report out in the fall. So very, very exciting about that. Next slide, please. And then the other linchpin, once we found out from the minimum data set for education that our RN programs are at 97% capacity. What we're learning from our supply data is, again, we have probably about 55% of our nurses are over the age of 50. And models in Connecticut for providing healthcare are changing. We really now have 2 predominant systems in the state of Connecticut. Hartford Healthcare System, which has the northern half of the state, and then Yale New Haven Hospital and their system, who has the southern half of the state. And they are morphing how they're using their human capital to provide healthcare in those regions. We really felt it was important to do a healthcare demand assessment, which we've never done before. Usually it's anecdotally or done by the trade associations, but really not a very good look at what the demand is. So after so much research, we actually are going to partner with your state, the state of Washington, for the Washington Center Health Workforce Studies Sentinel Network model. And we will hopefully be implementing that this fall. So very exciting that we'll be able to merge 3 databases together. Next slide, please. And I guess bottom line, and just to wrap up, big lessons learned. Establish a vision how these data findings and ultimately these reports can be integrated to showcase your nursing landscape and why it's important. The numbers themselves, if employers aren't feeling a pinch, or your schools have ample capacity, or recruiting has been easy for many of your large and small employers in your state, they don't find the relevance and the need to project forward. And so really the focus of what is that vision, and projecting forward for them, because as you know, it takes a long time to produce a competent and qualified nurse, and in what settings are they going to need those experiences, and what clinical placements are going to be part of those capstones and or programs is just so important. Another lesson we learned is common language. We in nursing, and actually I am not a nurse, I've been the executive director for 12 years, but started my healthcare career 30 years ago at the Hospital Association in Connecticut, coming up with common language so people are familiar how to compare apples to apples, and that was a big barrier for us related to the misinterpretation of the data we were sharing early on, and I think we're getting better about that. Regarding the MDS for supply, the whole demographics, obviously age, specialty setting, and educational level. Many people who aren't really familiar with nursing and nursing education believe a nurse is a nurse is a nurse, not realizing what scope of practice and barriers occur, that you just can't promote a seasoned nurse who's extremely skilled to a level of an APRN because they're not allowed to practice that way. So how can we educate our partners in healthcare and those of Board of Regents and the Department of Public Health and Department of Labor? They were also not realizing what are the barriers and entries into practice for many of the nursing levels. Next slide, please. Just wanted to leave my contact information if you do have any questions or comments. One thing that the Connecticut League for Nursing has is our CT Nursing Guide, which we actually list all of our schools and programs and every single program from doctoral down to LPN of what's offered to really be a good educational partner, not only in showcasing what schools and programs are available, but what those distinctions and what those different roles in nursing and where people work and what they can do. So we found that that has been really critical in helping the whole data message get out. So thank you very much.
Okay. Thank you, Marsha. Are there questions for Marsha before we turn to Patricia? Well, thank you. And Patricia posted a link to the Sentinel Network that Marsha mentioned in her presentation. And we will also include this in follow-up materials with the webinar as well, so that you can look more further into that work. Okay, so our final panelist is Patricia Moulton, and she is the Executive Director for the North Dakota Center for Nursing. And she will also talk a little bit at the end of her presentation, collaborative work between the Forum of Nursing Workforce Centers and the National Council of State Boards of Nursing that support collecting supply data for the nation.
Great, thank you. So the North Dakota Center for Nursing was actually started in 2011. It's an independent nonprofit 501c3. Do you want to go to the next slide? And our mission is through collaboration, guiding ongoing development of a well-prepared, diverse nursing workforce centers, workforce to meet healthcare needs through research, education, recruitment, retention, advocacy, and public policy. And you'll notice that research is like just one of 6. And I'll explain that as you see as we go through the slides. But the North Dakota has been studying the nursing workforce for about 16 years. And when we created the center about 7 years ago, we felt like, we should continue doing this workforce research, but it was really our opportunity to kind of move on and to actually work on some strategies to help with the nursing shortage. Next slide. So as far as our history, in 2001, our North Dakota State Legislature mandated the North Dakota Nursing Needs Study. I actually have included the link to the actual bill. But I will say that, first off, actually, they were trying to get a Center for Nursing funded, but the legislature said, no, we really want to know if we have a shortage. So we're going to fund this. Actually, we're going to say you should do this study, but we're not going to give you any money to do it. And so the Board of Nursing at that point tried to submit a few grants, and in some foundation grants. Didn't succeed, but decided to go ahead and subcontract with the Center for Rural Health at the UND School of Medicine and Health Sciences. Now, that might seem like a strange sort of thing to just up and do, but at that point, Dr. Mary Wakefield had just returned from, I believe she was in, I don't know where she was, St. Louis, I think, and had taken over the Center for Rural Health. And so they basically contracted with her, and then she hired me to do the North Dakota Nursing Needs Study. So the study itself was carried out for about 10 years. The legislative mandate sunset in about 5 years, but the board decided to continue to do it. And they decided to raise the licensure fees by $10 to help pay for the study. And North Dakota also joined the National Forum of State Nursing Workforce Centers when it formally was put together in around 2003. Can you switch slides? So the North Dakota Nursing Needs Study, and this is our chart of all the different studies we did during that time. Of course, when we started in 2002, you know, it looks all well planned and thought out, but it certainly wasn't at the beginning. This is certainly a process, especially working with all the different entities in the state. But the first year, you know, actually the very first study I did was a facility survey, because the first question the legislature had was, do we have a shortage? One of the ways to answer that is through a vacancy survey. But we also did a licensed nurse survey, and so each year we submitted a brief proposal to the Board of Nursing for our work for the next year, and a subcontract was completed each year. And I actually gave Sophia a copy of one of the later ones, if you guys are interested. And these final products were presented to the Board of Nursing and the legislature each year. I also have the final products for all of these on our website as well. Go to the next slide. And so we were doing this North Dakota Nursing Needs Study for all those years, but in 2003, we had extensive Practice Act changes. You guys might be aware, up until then, North Dakota was the only state that required a bachelor's degree for an RN and a 2-year degree for an LPN. For about 20 years, North Dakota was like that. In 2003, that was reversed to be basically what everyone else has. And that really dealt a blow to the nursing community, partly because it severed relationships between different nurses. And so basically the whole nursing community fell at that point. And in 2004, the Leadership Council was formed to help with healing that. And so the Leadership Council was like the presidents of the Nursing Association, the board, and all the various associations. And in 2008, we joined the Center to Champion Nursing with the Nursing Education Capacity Summit team. And our first strategic plan goal was to start a fully funded North Dakota Center for Nursing, which we figured then everything would just fall into place after that, which was a great plan, especially since I developed the plan and didn't think I was going to actually be doing it. But in 2009, we tried to fund the Center for Nursing again. There's a Senate bill language. It failed. They basically thought nurses should pay for the Center for Nursing. And so then we submitted an Otto Bremer grant, and we then eventually raised licensure fees by $30 to help pay for the center. That is, however, not in statute. That's more in rules and in agreement with the Board of Nursing. And so they do alter it based on budgeting issues. And so right now we receive $25 of that. So let's go to the next slide. So I mentioned it was a 501c3 nonprofit. We have 2 staff, and we have a board of directors, not as large as Indiana's, but it includes all the major associations and public entities involved with nursing. Next slide. But I also have over 210 leadership team members, which they are all on various task force groups and committees that carry out our strategic plan and carry out our work. So we have over 40 organizations, all the major nursing programs and nursing associations and entities in the state all working together. Next slide. And we have a pretty elaborate strategic plan. I'm not going to have them click on the plan, but you can certainly go look at it. But certainly those mission areas, the research platform with our annual conference, our faculty development program that we have through our education platform, our preceptor and our leadership webinars. We also do quite a bit in recruitment. We have a career center and recruitment efforts. And we also have a workplace culture project that we're working on to improve the workplace in order to retain more nurses. And also we have an evidence-based practice research center, and we do a lot with advocacy and public policy as well. So we're doing a lot of stuff in addition to our data collection. So it's become kind of a small part of our mission, but certainly an important part of the base. And we formed that strategic plan over the first 5 years of the center. And it's really, again, to extend us past data collection into strategies. So if you want to go to the next slide. So talk more specifically about supply data collection. For the first few years, you'll see it's the second row on that graph or on that table. When we did licensed nurse surveys, we did them for 5 years in a row to begin with. And back then, you know, it was kind of painful to collect that data. We actually used a scannable survey form. Right now we have about 20,000 nurses, but I'd say we had, I don't know, 14,000 then. So not a huge number compared to Washington and other states, but certainly enough to need to do a sampling of them and send out scannable forms and have them scanned and that kind of thing. So we did do sampling. We tried for a 40% response rate most of the time, usually received around 30%, but we kind of just made do with what we had. It was the only reliable data that we really had in our state. The supply minimum data set had not been created yet. It was created, I believe, in 2009, someone said earlier. So before that, it was a lot of demographics, but I also included a lot of nurse satisfaction and all kinds, just basically what we were interested in that year. We also, around 2004, 2005, our Board of Nursing started moving to online renewal. Before that, it was all paper renewal, although they would not send it out with the paper. It was just too expensive to send a survey with the renewal form. So when they started moving to online renewal, the Board of Nursing let us put a survey link to our survey in it. But I will say that us and many other states that have tried to do that, it does not work. There's much less response rate. People are very unlikely to click on a link to go to another website in the middle of renewal. So we didn't get a good response rate, but we used what we could with what we had. And my screen just shut down. Do you want to go to the next slide? I don't know. I am having technical issues here. Sophie, do you want me to tell me what's at the top of that slide?
Sure. National Forum of Nursing Workforce Centers and National Council of State Boards of Nursing.
Oh, okay. Yeah, so actually before I get to that, so, you know, so we tried the survey link, and then eventually after the supply minimum data set went into effect, trying to restart my screen here, that's strange. We were able to get the minimum data set questions actually added to the online renewal, which is by far the best way to do it. Several states do that. And so so now we get like 100% response rate, which is the ideal from everyone because they believe it's required. It's part of the demographics basically of the renewal form. And so every year we get that data from the Board of Nursing, and actually I get a data set every year from them. I don't analyze them every year, but I do that so that I can do trend analysis because the Board of Nursing data set, they continually update it and change it, but they don't really haven't historically backed up sets because that's not really the purpose of the database that they use. So this way I have a database to do historical trend analysis. But what I do is every few years, I download all the data and I use it to develop reports. Most recently, we've developed a report with the governor's nursing workforce. The governor has started a nursing task force. So we've been using the data a lot for that and for our projections. And so as far as that slide on the national forum of, so back in 2009, we developed the minimum data set. And that is because the forum at that point, you know, as a matter of fact, those first 7 years or so before we developed the minimum data set, A lot of forum members, like Marsha alluded to, we share a lot. And so you will find that a lot of Centers for Nursing do ask similar questions, and that's because we freely share our survey instruments. And so up to that point, everyone was sharing. But we thought, it would be great to have a data set that everyone collected so that it could be aggregated into a national data set so that we'd have something to compare against. And so we created that data set. Again, it's a minimum data set, which, certainly a lot of states do collect more. In North Dakota, we don't, because I only added the stuff to the renewal, and I feel like that's pretty adequate for what I need to do with it. But after that, we started implementing that minimum data set, but our dream was always to have an aggregated data set at the national level, where we would take all our different states and put them into one big database. We didn't really have the National Forum, doesn't really have the means to do that on its own. So a couple of years later, we decided to start working with the National Forum of State Nursing Workforce Centers, or excuse me, we're the National Forum, sorry, the National Council of State Boards of Nursing, because they also had started working about the similar time frame, putting together their national workforce database. And it's gone through a lot of different names and changes, through the NurseSys, and I know you guys are having some of your data added to that. And so they were actively trying to get more and more into it. Initially, the database was mostly for disciplinary purposes. So those of you that are on the boards know that you are able to go nationally to look up disciplinary stuff, but they're trying to add in our minimum data set to that. And so there's a lot of national efforts working on that. And what also happened in those few years near the end is that HRSA, they stopped doing the national sample survey. They did an RN sample survey for, I'm going to say, 20 plus years, and due to funding cuts and politics, they stopped doing it. But they recently, just this last fall, collected the survey set again. But in the interim, there were several years where there wasn't any national data to compare with, or for some states, you actually utilized the sample survey for their data. The National Council of State Boards of Nursing, the National Forum of State Nursing Workforce Centers, worked together on the national RN workforce supply data collection. So we every 2 years, the National Council of State Boards of Nursing and the Forum work together to put out a national sample survey. The last one was to RNs, LPNs, and APRNs. And what's nice about that particular survey, first off, is they use the minimum data set. That's the basis of the survey. And they had a few other questions, mostly regulatory questions. And the turnaround is really fast. The HRSA survey is done every 4 years, and it takes, I believe, 2 years to get the data out. The Forum and National Council of State Boards of Nursing, they put out their nursing report probably about 5 months after it's collected. It's really fast. It gets put into the Journal of Nursing Regulation in the summer. And the benefit of that is that it provides us all, well, first off, every state also gets their sample from it. But I will tell you, it's not really a good sample to use for a state because it's very small. The survey itself is designed to be a nationally representative sample. So depending on how well your nurses in your state completed the survey, you're going to have a pretty small sample to use. It's nice to use for national numbers, but some states have used it as their data, and you can do that, but it's very limited. So there's been a lot of efforts with that. And if you want, I don't know, I can't see the slides now. I've never had my monitor go down like this. But if you want to skip over to the IOM report, you guys are aware of the Future Nursing IOM report way back when, but there was also an evaluation done of how the nation was doing for the recommendations. If you want to go to the next slide then, part of the evaluation process was one of the recommendations is to improve data collection, especially since the HRSA sample survey had gone away at that point and the National Workforce Council had not started. And so the forum was invited to testify before the Iowa committee, and so I went and did do that. And we did give you the document that we developed for that. It's really a nice document talking a lot about the history I just talked about, but also it includes, you surveyed every state to figure out what their barriers were, so it kind of has a state-by-state information in there as well as far as how states are implementing national supply surveys. So it should be a useful instrument for you. And just to give you a little update after that, several work groups were developed after a summit with AARP and the Center to Champion Nursing. And one of them was to develop that national aggregate data set with the supply data. And I was actually the chair of that group. I actually am by default the chair right now. I'm trying to get rid of it. So we have the forum and NCSBN and many other researchers trying to figure out how to get this data set going. And right now we're trying to get the national data set at NCSBN. We're trying to get more states into that data set. So that's kind of where we're at there. And I'm sorry, I don't know why I can't see my screen or my slides right now. But did I cover all my slides, Sophia?
Yes, you did, Patricia.
Okay. Yeah, sorry about that.
I'll just say, though, that I don't have your contact information in case people would want to ask you questions directly. So I'm going to include that in the follow-up package to those who...
That would be great.
Okay. All right. Does anyone have questions for Patricia or other presenters?
This is Mary Sue. Can you hear me?
Yes. Yes.
Well, first of all, thank you so much, Kim, Marsha, Patricia. What a load of information that will be really helpful to us in Washington State as we go through. And so nice to hear all your voices. And I know you've been all doing great work in this area and others for several years now. But one of the questions I had, and a lot of them you answered as you went on, was Kim, your the portal, the Bowen portal. Can you talk a little bit more about that? Was that like already available to you and you were able to use it, or how did that happen?
The Bowen Center is fairly new. They're only about 2 years old. But they had a organization kind of prior to them that was a little bit different, funded in a little different way, and they did the analysis. They were hired to do the analysis for the data for supply. But this whole new Bowen Center is very well funded. It's got state funding coming from the Department of Health as well as the state, Indiana State, and revenue. And so they are put in place to do workforce evaluation. And so they exist within Indiana University, within the Department of Family Medicine. And so this portal is something new. It was opened up about a year ago. And so it was decided that why have all this data and not let people have access to it? So we all, were involved in these discussions, and it was decided to open it up. And so they created this whole opportunity online to create whatever kind of reports people want. And you can pick the fields, you pick the dates, you pick the kind of nurses that you want, or if it's not nurses or something else, they're going to start populating this. There's a lot more information on nursing than others, just because we have a lot more, and we've done a lot more from the past. But if you, I can provide the link, but you can certainly find it. If you look at the Bowen Center for Health Workforce Policy and Research in Indiana, as part of Indiana University, it will pop up in your Google search, and you just go on their website, and there's a section there about the portal, and you click on that, and it pretty much walks you through to create whatever kind of report you want with whatever data you want to include. Only, again, for the state of Indiana, but it certainly is a best practice.
Sure. I will visit it and play around with it. Thanks.
Yep, yeah, play with it. It's fun to play with. Very fun to play with. And it's great to hear your voice.
Yeah, nice to hear your voice, too. Yeah, brings back good memories of all the IOM work that we did together.
Doesn't it? Done some great work together.
Right.
Thanks, Kim and Mary Sue. Anyone else have questions at this point? Okay, well, we will close the webinar then, and feel free to either directly get in touch with presenters today. And as I mentioned, there were a few documents that were mentioned during the webinar that I will send out as a follow-up to our presentation this morning. So thank you very much for everyone for attending, and I hope this information has been helpful to you all as we move forward on this effort. Have a great day.
Thank you, Sophia.
Thank you.
Bye.
Good luck to you all.
Thank you.
Thanks, Sophia.